This video will be a quick refresher on Cushing syndrome and pediatric presentations as well. So Cushing syndrome, what are the three causes? It can be an exogenous stimulation of the adrenal gland due to exogenous corticosteroids. It can be endogenous. The endogenous production can be due to a problem within the adrenal gland itself, which is an adrenal adenoma or an adrenal carcinoma. Something higher up in the pituitary gland, which would be a pituitary adenoma, which is an ACTH secreting tumor, or it will be an ectopic secretion of ACTH by small cell lung cancer. So what kind of investigations do you do to diagnose this? You can do a 24-hour urinary free cortisol. This free cortisol gives us an accurate indication of whether or not the cortisol is high. Okay, and that high cortisol will then tell you that this patient has got Cushing syndrome because they have high cortisol. Cortisol is responsible for also increasing the glucose, the fight or flight, the stress response in the human body. And this is what someone with Cushing syndrome looks like. They'll have neurological symptoms like CNS irritability, personality changes. But their appearance, you'll see, is that of someone who has retained a lot of fluid and fat. So they'll have edema around the abdomen and the legs. They'll have central obesity. They'll have a buffalo hump and a fat pad. They'll have a moon face. And in males, it can present with gynecomastia. The fat can deposit in the back of the shoulders. And the extremities will be thin, contrary to how their face and abdomen appears. They're going to have thin skin and purple striae with bruises and petechiae due to the effects of cortisol within the systemic circulation. Now, what do we need to do to diagnose this? So there's two things you can do. You can do an ACTH plasma ACTH level and a high-dose dexamethasone suppression test. So, if the ACTH is low, that means, well, if the ACTH is high actually, let's say the ACTH is high and the cortisol is high, okay, that means that there's a problem with the adrenal glands. If the ACTH is high, that means that the cortisol being released by the adrenal glands is not going back to negative feedback on the pituitary to stop that release of ACTH. However, if the ACTH is low, that means it's a pituitary gland tumor or an ectopic ACTH secreting tumor. That's because the cortisol is actually negative feedbacking and stopping the production of ACTH. So, if the cortisol goes back to stop the production of ACTH, lowering the ACTH level, we know that this is going to be a pituitary gland tumor or an ectopic ACTH tumor. Because though that molecule of cortisol is not properly inhibiting the receptors on the pituitary gland. That's why it's a pituitary tumor. However, if the ACTH is high, that means it's an adrenal gland tumor. What about the 48-hour dexamethasone test? So remember, ACTH should not, if the cortisol is rising, okay, what should be the normal feedback? The ACTH from the pituitary gland should fall down. However, in this situation, the cortisol is rising, but the ACTH from the pituitary gland is also high. That means it's an adrenal gland tumor because the high ACTH is not binding to the adrenal gland to stop the production of cortisol. Maybe that's how you should think of it. Is the ACTH high? Yes. Okay, that means what should the adrenal gland be doing? Lowering the cortisol. If the cortisol is still high, that means it's a problem of the adrenal gland because it's not lowering the cortisol. If the ACTH is low, but the cortisol from the adrenal gland is high, that means there's an ectopic area from which the ACTH is being released.